Hi, Leslie.
Hi, Michael.
Now, I wanted to set this time aside to have a bit of a chat about Peggy, see how she's going.
Yes, that's fine.
Okay, great. Now, I'm interested in what you've seen or heard yourself and what some of the staff may have seen or heard. I'm particularly interested in any changes that you've noticed in Peggy.
Okay.
Okay, good. Now, has Peggy been anxious in the last week?
Yes, she has. Oh, several staff has mentioned it. She gets quite anxious over small things, like she wants to see a doctor even if she just has a cold. Says she might be dying.
Does she have an anxious or worried appearance?
Yes, she does. She's always frowning.
Do you think she worries about things more than other people?
Yes, definitely.
Can you give me an example?
Well, if dinner is running late, if her family is running late for a visit, or if her routine is disrupted in any way, she really worries, more than what you'd expect.
Does this worrying happen occasionally or often?
Every day.
And how much do you think it interferes with her everyday life?
Oh, she worries so much that she won't attend any activities. She'd rather stay in her room by herself.
Okay. Now, I want to ask you about how sad you think Peggy is. Have you noticed whether she's been down or sad in the last week?
Well, she's been sad all week, really.
As in a sad appearance, like sad looking, do you mean?
Yes, looking sad. Oh, and she had a bit of a cry too. Nikita noticed that first, and they had a bit of a chat.
Did you know what she was upset about?
No, not really. We asked her why she was crying, and she just says, nothing.
Okay. And does this happen often?
Once a week. Well, we tried to jolly her along, and she does forget about it for a little while. We have a cuddle, and it's over.
Okay. What about if something good happens, like a visit from the family, or she gets to go on a trip? Does she enjoy herself, or does the anxiety and sadness get in the way?
It depends.
Can you give me an example?
Well, she gets so worked up sometimes and anxious that she worries about going somewhere or someone visiting, that she gets to her bed. Well, she gets ill and goes to her bed.
Okay, all right. So, and how often would something like that happen?
Oh, just occasionally.
And how much would you say it interferes with her everyday life?
Only when it happens.
Now, has Peggy been irritable in the last week, like short-tempered, annoyed, overly impatient?
Yeah, she has been a bit short-tempered.
So can you give me an example?
Well, we just noticed the difference in the last week. She's been cranky and impatient. Well, not just with the staff, but she's been snapping at other residents too.
Okay. How often is she like that?
Well, at the moment, every day.
And how much does that interfere with her everyday life?
Well, a lot, really. Well, the other residents avoid her now. They can't be bothered with her. Before, she used to enjoy their company.
Now, I want to ask you about agitation, such as physical restlessness, hand-wringing, hair-pulling, and so on.
Okay.
Yep. Has Peggy been so restless in the last week that she's been unable to sit still for even an hour?
No, that's not happening.
What about things like pacing up and down, wringing her hands, sighing?
Yes, she sighs and wrings her hands all the time.
Do you think this is a problem for her?
Oh, yeah, sometimes we have to basically stop her. Because, well, it depends on the circumstances. Because if she continues wringing her hands, it escalates and she becomes distressed.
Right. Okay, now can we talk about slow movements, the slow speech, the slow reactions that you may have observed? Has Peggy spoken or moved slowly in the last week?
Well, Peggy has arthritis, so it's normal for her to be moving slowly.
Okay, does she seem to be thinking and reacting more slowly?
No more than usual. She's always quick to say what she thinks.
Okay. Now, in the last week, has Peggy complained of physical symptoms more than you'd expect? Things like pain, muscle aches, frequent urination, stomach cramps, palpitations, shortness of breath.
Yes, every day. I think she's complained about all of those at some time.
And is this interfering with her everyday life?
Oh yes, she talks about her problems all the time, and that tests people's patience, and sometimes they avoid her.
Okay. This next question is about loss of interest in usual activities. I'm particularly interested in any acute changes that might have happened in the last month. Now, does Peggy seem less interested in her usual activities or hobbies?
Well, Peggy used to love going to bingo, but in the last couple of weeks she has stopped going.
And now, is that due to physical illness or disability?
No, I don't think it is.
What about persistent apathy associated with dementia?
No.
No. So this lack of interest in things she used to enjoy, does it happen occasionally or often?
Often. And I think it makes her sad, because she always loved going to bingo. And she can hear the residents playing and having fun. That makes her sad and agitated sometimes.
Okay. Now, how's Peggy's appetite been over the last week?
Well, the other day after her family left, the other residents were sitting and having their meal, but Peggy said she wasn't hungry. But we did manage to get her to eat a little bit.
Do you have to encourage her to eat all the time?
No, she's still eating, even though she says she doesn't want any food.
Okay. Has Peggy lost any weight in the last month?
I'm not sure. I'll just check on her records.
Sure, no problems.
Oh, actually she has lost 1.5 kilograms in the last month. We need to keep an eye on that.
Thank you. How's your energy been over the last week, Peggy?
I get more tired than I used to. Don't seem to have any energy.
Do you think it's become worse over the last month?
Yes, it has. Oh,
You feel tired all the time?
I just said that.
I'm sorry, Peggy. Is it okay to keep going with the questions?
Yes, it's all right.
Have you wanted to stay in bed or sleep during the day?
Don't seem to want to get up for anything. I'd easily stay in bed all day.
Can we talk about your mood in the last week, Peggy? Is there any part of the day where you feel better or worse?
No, it's all the same.
You feel sad all day?
Yes.
Do you have troubles falling asleep?
No, never.
So have you been waking up in the middle of the night more than usual?
Oh, I get up to go to the toilet.
And you fall straight back to sleep?
As soon as my head hits the pillow.
Good. Okay. Have you been waking up earlier than usual in the last week?
No, I just get up when I'm good and ready.
Okay. In the last week, have you had any thoughts that life isn't worth living?
I'm not sure what you mean.
Well, have you thought you'd rather be dead?
No, never.
How have you been feeling about yourself in the last week?
Just the same.
Have you been feeling especially critical of yourself? Feeling like you've done things wrong or you've let some people down?
I've let my family down. I'll never get old. You're just a burden. I'm useless.
Do you want me to stop the interview?
No, it's all right.
We're nearly there. Only a few more questions. I just wanted to ask you if you've been feeling guilty about anything.
No. I feel guilty. I'm so much trouble to my family.
Have you felt pessimistic or discouraged about your future over the last week?
No. This place is good. My family are wonderful.
Is there anything you're worried about that maybe other people don't understand? Maybe they think it's strange that you're worried.
No.
Okay, well, thank you for talking with me today, Peggy. That's all the questions I have for you. Can I get you anything?
Oh, thank you. I'll just sit here.
Okay, well, I'll come back and check on you in a little while, okay?